podcast today. How you doing?
I'm doing great. Thank you for having me today, Kelly. Appreciate
I'm
it.
excited. This is a long time coming. So you've been a nurse and in a caring profession for how long?
Over 25 years. Yes.
Okay. And being a Black woman in health and healthcare, being a person, period, in health and healthcare, were you taught about mental health? This is World Mental Health Day. Were you, I know you were taught how to take care of other people, but was taking care of yourself and your mental health ever part of your curriculum?
The curriculum was so long ago, Miss Kelly. I remember learning about taking Psych 101, Psych 102, learning about mental health and psychology. It wasn't until later on in my career that I started to learn about mindfulness and the importance of mindfulness and self-care. I think when you're in nursing school, you're just on an automatic go, go, go. You're trying to study and take care of yourself, take care of your care plans and your patients and studying. And I believe that the nursing curriculums now more so, um, maybe not the curriculums, but the colleges and universities include
Mhm.
self-care in curriculums in one way or another.
So what was the aha moment? I'm trying to make us the same height. What was the aha moment for you to start focusing on your mental health? When did you know that was something you needed to do for you?
When I knew it was something needed for me, I think I had to learn to take time for myself when I was diagnosed with lupus. Um, it was a very stressful time in my life. I had just lost my aunt, and it was so stressful on my body. And at that time, I knew I needed to take time out for myself. And I knew moving forward, I needed to continue that. And also in my position that I was in at that time at the organization that I work at, I reported to a beautiful woman. Her name is Donna and Brown, who believes in self-care. And when she saw that there were times when I was overwhelmed with life or with what we were going through at work, she would say, "Okay, let's take a moment now, or take a break. Let's go for a walk." And she really helped show me that it is important to take care of myself before I try to take care of other people. And so sometimes it takes that special person to pull your coattail and say, "Hey, you're doing a little too much right now." And it's okay to say no. It's okay to say no. Everyone's emergency is not your urgency. And so, yeah, it took some time. It took some growing. It took some life bumps in the road to actually put myself first in my own self-care. And that's something I still, it's easy to put somebody else before yourself when you're in um, a care provider role, when you're a caretaker. It's easy to continue that even when you get out of your role at work. So I still struggle with that from time to time, but I'm better at self-care now than I've ever been before.
So what are some things you do? What's Dr. Michelle's self-care routine like?
Years ago, I loved karaoke. I mean, I still love a good karaoke night, but there would
Mhm.
be some times where I would just sit in my living room and just sing it out. Like whatever I was feeling, I would just sing, sing, and sing all by myself. Um, but here more lately, I've taken up knitting and crocheting, and for some reason that alone is therapeutic for me. Um, it helps me to take some time out for myself. I enjoy seeing the outcome. I have taken some mindfulness sessions, and I'm learning how to um, do more nasal breathing. Um, uh, it's taking time to just take some deep breaths and visioning yourself somewhere where you love and you enjoy, and positive affirmations have really helped me.
Awesome. So you and I go back a couple of years, a day or two, right? Um, and I've had similar experiences
Hmm.
with Donna Brown. And I think that a lot of people, especially women, especially Black women, don't have someone that holds space for them and pulls their coattails like, look, sit down.
Hmm.
You need to take care of you. No, we don't do that no more. You need to then fill in the blank because they know you with the
Hmm.
things that are helpful for you to be
Hmm.
able to do to take care of yourself. Um, in what ways do you see that being supported maybe uh in your personal life? Like have you so like I know for me there's warning signs that I mean not like um fire alarm warning signs, but just things I know to pay attention to
Hmm.
so that it does not become crisis mode to let me know I'm not being mindful or I'm not breathing right. Um, I need to slow down. I need to reevaluate. Have you found some of those things in your life that lets you know, okay, I need to do a little more for me?
Hmm. My family is I'm very connected with my family. Um, I'm very spiritual. My pastor, will call me out of the blue and he doesn't even realize what kind of day I'm having. And I just say, Lord, thank you for, I call them kisses from God, where he'll show up right when I need him, when I didn't even know that I needed him. And that my relationship with God and my family, and I have a group of girlfriends that we are called the Ladybugs, and we support each other in all areas of our lives. And I know when they're asking me if I'm okay, like Michelle, are you okay? And I'm like, uh-oh, am I okay? So
Mm-hmm.
I have been blessed to have people around me that love me and support me. Um, at times when I don't even recognize myself that, I may need to take a break and a pause. Um, like I said, Donna Brown has been instrumental for me, and Yannick Caravel Jenkins, and my current immediate supervisor, Ron Schulerman, who is very supportive. He's a social worker, but he has a leadership style that has continued to help me to grow and recognize some things about myself that I can pump my brakes. He's like, all right, Michelle, pump your brakes, and I, because sometimes you just get so wound up in things, and when you're dealing with patients and their lives and their traumas, um, sometimes you can get, I won't say overwhelmed, but your heart is just can be so heavy from your surroundings. And I'm glad that inside of my current position, but in my life, I have been very blessed to have wonderful people that have supported me throughout my years here on this earth.
I'm glad you have them too, because you've been that for me.
Oh.
And no, Michelle, I mean, even um, so towards the end of my time at the corporation, um, I remember you just coming into my office and saying, "No, Kelly, wear your goggles. Like, what you need glasses on top." I mean, just little things that
Mhm.
are physically helping me, but my mind wasn't even focused on the task at hand, which is living in the midst of a pandemic. Like I'm just all over the place. And you saying, wait, where are you going? No, you need to stay right here. Or being in the hospital. And I'm
Mhm.
like, well, I guess I just have to go home and take care of myself. Then you're like, you're
Mhm.
not going anywhere.
Yeah.
Just lay right here. I'll be back.
Mhm.
And so you've been in a position to let me know I need to slow down and take care of myself and advocate for myself in ways that I would not have done and literally wasn't doing before you said you need to stop and advocate for yourself. And
Wow.
while you figure that out, I'm gonna advocate for you because you're not going anywhere. So thank you for
Oh,
loving
Kelly,
me.
you are so welcome. You've helped so many yourself. I mean, Kelly, that play, I can't remember the name of the play
Oh,
that you and
Girl, get your
Mhm.
breakthrough. This is my story
Yes.
with Latricia, Empowered to
Yes, with
Emerge.
Latricia Davis. That was amazing. And sometimes people don't understand when you share your story, because everybody sees Kelly smiling. They see us smiling because we are smiley people, but you don't really know my story. And right now, I'm in a point in my life where I am an open book, where there were some experiences that I've had in the past that I may not have shared. But I realized that the stories of other people around me have helped me along the way of this life journey. And so you setting an example for other women, other people, to share their stories is impactful, and it has impacted others' mental health, whether you realize it or not. It has impacted others that are around you.
Thank you. No, I don't. I mean, and that's okay. But thank you.
You're welcome.
All right. I don't have a question right now.
Okay, well, I will share, because it is mental health, World Mental Health Day, and the theme for today is Our Minds, Our Rights. And
Mm,
on the World Mental Health website, it says good mental health is vital to our overall health and well being. Yet 1 in 8 people globally are living with mental health conditions, which can impact their physical health, their well being, how they connect with others, and their livelihood. Mental health conditions are also affecting an increasing number of adolescents and young people. Having a mental health condition should never be a reason to deprive a person of their human rights or to exclude them from decisions about their own health care. Mm. So I'll just stop right there. So your mental health can impact, every area of your life.
yes.
And I thank God, that right now at this time in this moment that I am mentally okay, because there are things in life happen so quickly. And to be able to it's only one trauma. We're all one trauma away.
Right.
We are one trauma away. And that's why it's important to practice self-care, mindfulness. What are your coping skills when things happen in life? What are you doing to take care of yourself? So when things happen in life, you're able to do your best to deal with them. And are you comfortable with saying, I am not okay and I need help? I need help. And, here in this area, we do have the Help Center, which is located at 462 Grider Street. It is open from 8 a.m. to midnight to help you. If you need someone to talk to, you need to talk something out, you may need a counselor. There's also crisis mental health services that's available 24 hours a day. Um, I can look that number up. 24 hours a day that is available.
And so I have people dial 988 because no matter where they are, they'll get their local crisis services.
Okay, so
And so when
988.
people dial 988 here, it goes right to crisis services.
Okay. So that is a good resource. Dial 988, and that'll, like you said, you'll reach and you'll get in contact with your local crisis mental health services. And so it is okay to ask for help. It is okay to say that I am not okay. And that right there is the first step. Just to recognize within yourself before somebody else recognizes it, is a wonderful insight that you could have for yourself.
And to be able to catch it before it becomes so unmanageable, right? I am in the midst of a re-diagnosis because what uh the way my therapist put it, and it kind of made me laugh, and not kind of, I did bust out laughing when she said it. She was like, in the middle of a crisis, I mean, anyone can appear to have borderline personality disorder or
Mhm.
bipolar disorder, or you're in the midst of chaos, and so who you are on a day-to-day basis is not necessarily going to be reflected in the midst of a crisis. And so to have a diagnosis based on your crisis versus, your long-term positioning and conditioning and life and experiences and responses, um, are two different, two different scenarios. And so now that I'm in this place of normalcy,
Mhm.
what does my mental health look like, and where do I fit, and what are the issues that I have that um, are more severe, that look like perhaps something else when in crisis mode. Um, so it's interesting to be in this part of um, the journey, but to be okay and saying that, I identified with this um, diagnosis for so long,
Mhm.
but it helped me, right? And so I don't. Um, I talk to folks a lot, and they don't want a diagnosis. They don't want to know, the name of the thing that it could be. And if you don't want a diagnosis, you don't have to have one, right? But where are you in your journey, and what tools can you use to assist you?
Mhm.
So learning about mindfulness with one hat on, I might not have ever learned about mindfulness and meditation and all of those tools if I
Mhm.
didn't have the diagnosis of borderline personality disorder. And
Mhm.
so I'm thankful, regardless of the diagnosis, that I was able to have the tools, was able to have therapy, was able to, be in a position to get help,
Mhm.
regardless of what the name was. And um, I I would love for you to just speak to being a health professional, and what a diagnosis can mean to someone who is also a health professional, just a professional in general, where mental health is something. Having a diagnosis may hinder you from being able to do the thing that you love. That makes sense.
I think
Um,
the day and age that we're in, and Kelly, I've seen it on both sides of things. There are people that do not go to their primary care providers because whatever's going on in their bodies, they don't want to know about it.
mhm,
So I see it on both sides. I see it on the physical and mental side of things. Um, but we have there's disease screening, disease prevention. Um, and now when you do go to your primary care provider, they are asking you about depression and anxiety because we can, before even getting a diagnosis, we can see, okay, is there something going on just currently, an event in your life that's causing stressors, that's causing your depression or anxiety? Or is this something mentally that's happening that we can start with counseling, the least invasive? You start with
mhm.
counseling and therapy. And then if medication is needed, we can, as providers, we can help you cope with whatever is going on to our best ability. And that's also in the physical standpoint. That's what screening is for. Um, for colon cancer, for um, breast cancer. The screening is just to help to say, okay, is this coming? Do you have it or not? And so it's the same thing with mental health. We're trying to get ahead of that so that we can help you if you're pre-diagnostic, or if you're going to have a family history of a diagnosis. And it's not to it's to help you continue to do what you love doing. And it's to help you to, before you even start to do the things that you love, to help just to build you as a whole person. We can't ignore your mental health because that's a part of your whole being. And so as providers, we want to do whatever we can to support our patients.
So what would you, suggest, or suggest may be the best word. What are some steps that people can take to begin to address their mental health?
I think just overall, mental, physical health is continue or talk with your primary care providers.
Mhm.
Talk with your primary care providers. And if you don't have one, seek a primary care provider. A lot of employers have systems in place for their employees. employee assistant programs, the human resources office, the health office where you're getting your physical exams. And if you're not employed, there are places like the help center, there's crisis services um, that have systems in place to help you with your mental health. But definitely talk with your primary care providers and be open and honest. Be honest about how you're feeling. We have been working on the stigma of mental health, for years, but I feel like the day is coming, where there's not that stigma with mental health, where it is okay to talk about your mental health. I mean, years ago in the household, you did not talk about, how you were feeling, or, your parents was like, you do this because I say so, and it's like,
Period.
okay. But now you can talk of these kids are talking about feelings, how they're feeling. And, COVID did a number. COVID did a number on our children and our adolescents where they were home and you know I don't want to use the word isolated because I don't know what everybody's home looks like, but
Hmm.
I lived alone on the second half of this COVID, and um it did a number on our communities. And so we are seeing a rise in adolescent mental health, and it may have already been there, but now it's more talked about in homes.
And so young people, a lot of schools have counselors,
Hmm.
school counselors, mental health therapists, on site. Teachers are
Hmm.
generally safe spaces.
Hmm.
Um, and so EAP, if you're employed, most employers have EAP programs, and those are confidential and free. So no one will know when you call who you are.
Hmm.
The person that you are talking to. Usually EAP is a company that's paid, by your employer, so they're not even in um, your directory. They're not employees of your organization. And then the crisis helpline 988, friends
Yeah.
and family, like you mentioned, your pastor. So
Yes.
faith leaders are also a great place to go.
Yes. And if you're a college student, your college and universities have resources in place for you as well. I commend Niagara University's nursing program hired their own counselor for their nursing students. So the colleges and universities want to support their students as well.
And I've seen a greater shift in colleges and universities in schools. So mostly, universities that didn't have schools, instead of having the overarching student success, student retention, or like health center,
Hmm.
they now have professionals within the school, within the departments that students can talk to. Because, it no group is a monolith, right? And so an engineering student may have, similar life things going on, but the demands of an engineering student are going to be different than the demands of a nursing student, different than the
Hmm.
demands of a education student. And so
Yeah.
being able to have a professional that understands the curriculum and understands what that student is going through, is really helpful. Um, I can imagine it being helpful. I did not have that. That was, we, they didn't have that then.
Hmm. We did
And
have
that's
a
okay.
center at it was D'Youville College at the time, and we did have a counseling center. We did. I remember
Did you
that.
have one? We had one when I was at Stony Brook. There was one for Stony Brook University, but there wasn't. Um, I was also only there for a year because I got pregnant and came home. So we're
Okay.
not going to count Stony Brook in that experience. I don't know what Stony Brook had. Uh, but I did. They had like groups and things like that. So I do remember going to those. And then being at Canisius had, and still has the health center.
Mm-hmm.
And for me, I actually, because I was a professional, with a real job and benefits, and left my professional job to go to Canisius full time,
Mm-hmm.
became a full time grad student. So had to use Canisius health benefits in order to be able to still get therapy. That was the first time I went to CPAP. So I didn't know.
Mm-hmm.
We were trying to figure out how to get me medication because I no longer have regular health insurance, and we didn't qualify. Our family, that borderline family, we made too much as a household for Medicaid, but we couldn't afford family health insurance through. the employer's health insurance for my ex-husband. And the counselor was so sweet. So she found out all about CPAP and their emergency medication program.
Mhm.
And neither one of us knew the whole process, though. And so when I went, they immediately took me back. I was so excited, like, oh, wow, I don't have to sit here and wait. I didn't know they were taking me back to CPAP to lock me in CPAP. So like they
Mhm.
closed the door and locked it. I was like, oh, wait, what? What's happening
Mhm.
here? So understanding the process and what's
Mhm.
going to happen, I
Mhm.
think is um, instrumental in being able to receive assistance, because had I been in a different headspace, that might have created, a crisis episode,
Mhm.
because I wasn't expecting to be locked in a space where I could not leave. Um, but thankfully, that did not happen. And that was a non-issue for me. But I think having, opportunities like this where people can talk about their experiences and be able to get to learn about what happens when you go, so that they're prepared when they go, will
Right.
help, with the healing process. Um,
And we are trying
any,
to, we're in the process of, you know, g- advertising our hours for the help center for cases where you may not need to necessarily be in a psychiatric emergency room, and
mm-hmm,
you just may need some resources just to help you through a rough time, and then help you get connections to the community. That's why we've extended the hours of the help center for cases that you speak of, because not necessarily everyone needs the psychiatric emergency room, but they do
right.
need help.
And needed not 3 months from now. And so,
Right.
full disclosure, like that was more than 20 years ago, right? So life is different now.
It is.
Rules have changed a lot. Programs have changed. There are places like the Help Center where you
Mhm.
can see someone that day for assistance and it be, a doctor's appointment. So,
Mhm.
um, I don't want anybody thinking that that's what life is still like out here in these streets. But, um, so World Mental Health Day. Any closing thoughts? I don't want to keep you too long. Anything you want to make sure people know, make sure that we talk about, make sure people understand. Um, oh, advocacy. So when it comes to advocating on behalf of your loved ones, mental health, physical health, just across the board, what are some um, things that family members and loved ones should be aware of? Um, because I think that would be helpful for people. If I'm helping my child or friend through a crisis situation, what are perhaps some things I should be aware of to mention or um, do for that person
Mhm.
to assist them through this experience?
So, just speaking, if someone is in the immediate danger of hurting themselves or hurting someone else, that's a 911 call. You want to make sure that person is safe as soon as possible. Um, and just it's you don't it's hard because, and I don't know how to say this, Kelly, because people may take on somebody else's responsibility for their life. Like, I should have done this. I should have done.
Mm-hmm.
I could have done. I should have done. And we got to be very careful with woulda, coulda, shouldas on ourselves, because sometimes we don't see the signs, and the signs. Sometimes people don't share their signs and symptoms, and so I'm very careful with that because. Um, Unless somebody's openly expressing how they're feeling, it's hard to say what you should do, but there are some symptoms that you could look for. Like if somebody's hygiene has changed, like if somebody is constantly, like all of a sudden they're disheveled, or their hygiene has changed, or they're losing weight. There are some outside appearances that you could see that may say, something's not right. Something's not right, or somebody's not showing up to work. You can do a wellness check on someone. Um, there are things that you can do, but I think the most one of the things that I just want to share is making sure that you take care of yourself, um, and share that, because if we're all trying to take care of ourselves, then we could take some responsibility for our own mental health. And but there are ways that we can see signs and symptoms from some people. If somebody's hearing voices, or they're responding to things that other people don't see around them, that is something that is evident, that you can look, not actually look for, but if you see it happening, because you don't want to start looking for stuff, because next
Mhm.
thing your mind can be playing. The mind is a beautiful
Right.
thing. The
Right. That's
mind is a
real.
beautiful thing. The mind is a beautiful thing. And but just to be mindful of and being present in the moment with who you're with. Like I could be having a conversation with Kelly, but I'm thinking about what am I having, where am I going after finish talking to Kelly, versus
Mhm.
focusing on Kelly and being present for Kelly when I'm talking to her. So I can say, wait a second, Kelly, are you in pain? It may not be mental, but Kelly, your face is showing me that you're uncomfortable. So just being mindful, I would just recommend for people to just be mindful in the moment and be present for who you're around and who you're with, and just be mindful for yourself.
And so, this is the start of season 6. This is our second episode in season 6, and season 6 is all about mindfulness.
Oh,
So,
wonderful.
yeah, so it's just perfect that you're bringing that up, because it I think is so, well, important. I've said important like 15 times in a row, but
But it is.
it's it changes your body's reaction to
Mhm,
stress.
mhm,
It changes how you show up for other people just by
mhm.
being mindful, right? By just saying, I'm connected to Michelle right now.
Yes.
All that other stuff is going to be there when our conversation is over. I can't do nothing if I'm thinking about it, no way, because I'm right here with Michelle. So let
Right.
me be here and focus. It changes the body and how it responds.
Yes.
So
I wish
the
I could
fact that,
remember Rebecca's
mhm,
last name, but she did a mindfulness series at our organization. And one of the examples that she talked about was being mindful, even when you're taking your morning vitamins, like, okay, vitamin, I'm taking you in, because we might
yes.
get downstairs and be like, dang, did I take my vitamins? But if I'm being present, being present, I'll use the example when I unplug my iron. Sometimes it's like a habit. You unplug it, and I get downstairs and I'm like about to leave the door, and I'm like, oh, did I unplug the iron? And I'm going back upstairs, knowing it's just the mind could just play some, you know, tricks on you. But if you stay mindful, like, okay, I'm about to unplug the iron. It's just something
Hmm.
simple. But just being mindful in the moment. I'm gonna take my medication, being mindful in the moment. So there's just some things that we can do for ourselves. Mindfulness is it is a serious, um, I don't want to say a task, but it's a serious place to be when you're mindful in your conversations, in your actions. And I'm excited about your series, Kelly, and I'm just gonna have to make sure I take the time to listen so I can learn more, because there's always opportunities to learn more.
Hmm.
So
There
thank you for
are.
that.
Always. Thank you. I just finished with Brown University's. First, there's several levels to the training, but we just completed the first level of the training. And one of the things that I picked up, because I was saying to myself, I want, I should,
Mhm,
and had
mhm,
to cut that out of my vocabulary.
mhm,
But I did want to be able to spend 45 minutes a day on mindfulness. And so while I was in the classes, I did my homework. I made sure I did that part of it. But one of the things that I picked up, because I also told myself, I want to pick up something I'm going to keep. Like, what am I going to stick with?
mhm.
And so one of the things that I still do is brushing my teeth, mindfulness. So
Okay.
my toothbrush has the 2 minute, like you press the button and
Uh-huh.
so every morning I'm mindful. I'll be the first one to tell you, I will go to bed without brushing my teeth. I know you're not supposed to, but
Uh-huh.
like for sure, I'm brushing my teeth in
You're
the
not leaving
morning.
the house without
So
brushing on teeth.
right. And so that has been a part of my routine. And to
Mhm.
just be mindful, like, what does a toothbrush feel like? What does it feel like on my gums? What does it feel like
Mm.
in the places where I'm missing teeth? Where
Mhm.
does it feel like, what does it feel like on my tongue? What does it feel like on the inside of my gums,
Mhm.
outside of my gums? Just,
Mhm.
oh, the toothpaste, it tastes a little extra sugary today. And then my mind would be like, well, why is there sugar in toothpaste? They really
Mhm.
shouldn't have sugar, but like, oh,
Mhm.
wait, no, bring it back,
Mhm.
bring it back,
Mhm.
bring it back. What do the bristles feel like?
Yes,
So
Kelly.
so that's been my big takeaway.
Yeah.
Lots of takeaways, but that's been the big one is my 2 minutes of mindfulness every morning.
Mm.
Um, if people think I'm disgusting, well, I'm just disgusting because I
Just
don't know, I
being
brush my
honest,
teeth at night.
probably millions of people are doing it, Kelly.
I'm getting into bed. Good night. But um, and I've enjoyed that practice
Mhm.
and just knowing that it's there because I wake up and I'm ready to go.
Mhm.
Like, oh, okay. Thank you very much for giving me another day. Use me how you want to use me. I got to do
Mhm.
everything. Let me check my email real quick. Let me do it. Let me take my 2 minutes of mindfulness, and it helps me reset before everything, kind of
Mhm.
gets wild and unruly. But yeah. Any closing thoughts?
In closing, I just want to just thank you, Kelly, for keeping mental health and healthy illness in the forefront of all of our lives. You have been a positive example of what being transparent can do for people and do for our community. So I just wanted to take this opportunity to just say thank you for what you have been doing. And just keep up the good work, keep up God's work, and may God continue to bless and keep you, and may his light forever shine upon you, Kelly.
Thank you. I
Thank
love you.
you. I love you too.
I'm dealing with being able to accept positive statements and stuff. It's not easy.
It's not.
It's okay though.
It is okay. Let me tell you, this is part of the recording, but it's off the record, whatever you want. There
Oh
was
wait,
a
hold on. I could turn it on.
there was a time when when somebody would say, "Oh, your hair looks, oh, you look pretty," and I would ignore it. I wouldn't know how to say I wouldn't say thank you because I, I just, it was, that's just where I was. And oh, you look nice today, or and I would, and I'm like,